Good day, everybody. Thank you very much, everybody, for coming to Pallium Canada's virtual AGM. My name is Louise Bradley, and I have the honor and privilege of being the chair of the board of directors for Pallium Canada. Before I launch into further remarks, I just want to show everybody, I'm hoping everybody has a copy of the agenda so that you'll have an idea of what to expect today. And then I'd like to take a moment to honor the land that I am presenting from, which is the traditional unceded, unsurrendered territory of the Anishinaabe Algonquin people. Pallium is incredibly grateful to be able to work on these lands and to advance the quality and accessibility of palliative care for all people in Canada. I am pleased to share that we have a very special guest with us today, Professor Dr. Carlos Centeno, Director of Palliative Medicine Services at the University of Navarra. And he will be speaking to us later in the program on the work his team in the Atlantis program at the Institute for Culture and Society at the University of Navarra have completed on palliative care atlases for different countries and society at the university. He'll also be speaking about the exciting partnership between the University of Navarra and Pallium Canada on the work that is currently underway on the Canadian Atlas of Palliative Care. Thank you, Dr. Centeno, for joining us today. Now, 2022-23 has been a momentous year for Pallium, a year that has brought both new challenges and exciting new opportunities. Our unwavering commitment to advancing palliative care during the challenging circumstances of the past few years is a source of pride for us, and we have emerged from these challenges even more resilient than before. The outstanding progress resulting from our collective efforts and resolute dedication has yielded exceptional growth, making this past year stand out as our most successful thus far. Isn't that amazing? You're going to be hearing more detail about that from our CEO, Jeff Moat, in just a moment. Just want to say that the groundwork we've established over the past 2 decades positions us favorably to continue to grow and advance our vision and our mission. In collaboration with our valued supporters and with the support of our community of facilitators and stakeholders, we have continued demonstrating our impact, building on our foundation, and growing into our leadership role throughout Canada. Our supporters play an essential role in enabling us to undertake our work to equip healthcare professionals and communities with the knowledge and tools to provide palliative care to every single person in this country. We believe in a collaborative approach to building palliative care capacity and to benefit all people in Canada. And during a year of important transitions, many of our achievements this year were only possible due to the commitment of our supporters. And we thank you very, very much for your generosity and ongoing support. Thanks to years of commitment and hard work, we're now witnessing the tangible results of our efforts. Pallium is well positioned to leverage its past successes and current infrastructure to provide national leadership in palliative care through its collaborative pan-Canadian network of partnership to realize positive systemic changes. We have also welcomed new members to our board of directors, who you will hear about shortly, and they will play a vital role in advancing this agenda by providing new perspectives and adding to the diversity of experiences. We also have to say goodbye to others, but we'll be recognizing them just a little bit later. We extend our heartfelt gratitude to our staff, board members, facilitators, learners, our leadership team, and partners for the remarkable contribution throughout the year. It is not only the accomplishments they achieved that hold significance, but also the manner in which they accomplished them, demonstrating consistent commitment and genuine care for one another and those we serve. We look forward to continuing the work with you to ensure that all people in Canada have access to better palliative care. So I'll finish my comments at this time and hand it over to our CEO, Jeff Moat. Over to you, Jeff.
Louise, thank you so much. And hello, everyone, and welcome again to Pallium Canada's annual general meeting. First and foremost, I want to express my sincere gratitude to each and every one of you for your unwavering support and your dedication to our organization. This meeting is a testament to the strength of our community, our shared vision, and our commitment to transparency and accountability. As we gather here today, I am reminded of the remarkable journey we've all been on for the past few years. And despite the challenges and the uncertainties we faced, our resilience and adaptability have proven that we are an organization that can weather any storm. And our achievements and successes would not have been possible without the incredible talent and dedication and passion of our employees, the trust of our board, the support of our partners, and the loyalty of the clients who we proudly serve. So today we have the opportunity to reflect on our accomplishments and chart a new course forward for our future work. So let's go to the next slide. So in terms of before I get into the details of Pallium's work over the past year, I want to begin by highlighting some of the organization's key achievements. Our LEAP program performance, both in terms of the number of learners and course sessions, have surpassed the levels we were at prior to the pandemic. And I'll be showing in just a moment a few graphs that demonstrate this growth. Overall, as a result, Pallium's financial performance has also exceeded its forecast. We've experienced a strong rate of success with our funding proposals to support the work that we do. In particular, we have received numerous family foundation donations, which come with a strong sense of commitment to Pallium's mission and values. Family foundations provide essential funding that allows us to plan and execute long-term projects, expand our programs, and reach a broader audience. But beyond the financial support, these donations often establish lasting partnerships, bringing together shared visions for positive change in palliative care. Where Pallium has truly shined has been its ability to extend its value beyond our LEAP training. When we have partners who approach us to develop customized training solutions that leverage our capabilities beyond palliative care, then we're tangibly demonstrating how we can leverage our assets beyond what we were originally created to do and improve other parts of healthcare. And I'll share some tangible examples of that a little bit later on in the presentation. Since we've introduced our learning management system in 2014, we've captured vast amounts of data on our consumers, on our courses and on our learners. And we've leveraged this information to publish numerous scientific papers. We've also used this data with our partners to help them evaluate the impact of their investment in training. As an example of that, we're just wrapping up a study that José may touch on a little later on the long-term impact of LEAP training on healthcare professionals in the province of Nova Scotia with our partners at Dalhousie University and the Nova Scotia Health Authority. We're also able to use our data to inform decision-making, reaching new audiences, personalize the communications that we do, and better forecast our key performance metrics. Our IT ecosystem has evolved as an organization, as our organization begins to mature, and our needs for greater efficiency and greater effectiveness in our work will continue to be enabled by technology. So whether that's through automated reporting, triggered-based communications, to target audiences, making it easier for our learners to sign on and access data in our courses, or linking our various technologies to make them work harder and smarter. It's an ongoing journey and will remain a fundamental priority of this organization. Our reputation and our influence really does continue to grow, and that's in thanks to a number of items. It's our continued success at spreading trusted solutions deeper into health systems and working with our partners to develop customized solutions to meet their unique needs. The caliber of our programs and our responsiveness and our after-sales support to our partners, our commitment to research and evaluation, and even the implementation of our government relations strategy. It's all played a part to help us grow the brand, the name of Pallium. And as we know, the pandemic has had a profound and disruptive impact on staffing across different industries. And while we certainly did, experience some departures, we do feel we've reached a point of stabilization with the team. And, our return to the office here in Ottawa has helped strengthen our ties with our team members and build up that camaraderie and interpersonal relations. So that's a high-level summary. Let's jump now into some data. Next slide, please, Sarah. Thank you. So as I mentioned, the pandemic has significantly disrupted in-class learning, which is clearly evident in this graph. Lockdowns and health concerns forced the swift transition to online learning, challenging the traditional classroom model that we've become used to. So our facilitators and our learners had to adapt to remote teaching, which presented technical, pedagogical, and equity-related challenges. But despite these hurdles, for Pallium, the pandemic has accelerated innovations in digital education technology and remote learning methodologies, highlighting the potential for blended learning approaches, right? The pandemic underscored the importance of flexibility and adaptability in education and emphasizing the need to continually evolve teaching methods to meet the changing needs and circumstances of our learners. And thanks to quick adjustments to Pallium's course delivery strategy, coupled with the introduction of self-directed online courses like LEAP PSW, we've been not only able to recover, but actually surpass the number of learners trained pre-pandemic. Our business development team has realized a substantial growth in licensing agreements over the past several years, and licensing agreements now account for about 80% of all of our revenues, which is 172% growth from previous years. So, and licensing, for those of you who are familiar with the concept, it's a multi-year contract that secures a client's commitment to undertake LEAP training, and it provides a number of benefits. It's cost certainty to our clients, it affirms their commitment to continuous learning over several years, and it provides flexibility in terms of the type and timing of courses delivered. So just following on this on the next slide, we see a similar trend here with respect to our LEAP course sessions, right? The pandemic certainly impacted volume, but we're seeing that really starting to ramp back up again. There were some targeted provincial and federal investments in paramedic training, actually, that drove surges before and even during the pandemic, which is interesting. That's why it didn't grind to a complete halt. On the next slide, in terms of the profession of our learners, nurses continue to make up the largest contingent of our learner base and are slowly increasing back up to pre-pandemic levels. Physicians are down compared to pre-pandemic levels, which really isn't a surprise given the immense burden on these healthcare professionals. Longer working hours, many find it challenging to prioritize additional training amidst their demanding schedules. But this has been offset by the increase in the number of personal support workers and other allied healthcare professionals who are taking our training. Next slide, please. Our number of our LEAP facilitators, these are our certified trainers, declined this past fiscal year due to retirements, career transitions during the pandemic, along with rationalization and a cleanup of our facilitator database. The current cohort of facilitators is meeting partner needs, and our team is focused on strategic facilitator growth to support our new licensing partners. And one of the benefits of the transition to more online training is that it's allowed Pallium to reduce the burden on facilitators by cutting in half the number of facilitation hours required per course, not to mention less travel and prep time. Next slide, please. Every year we entertain really hundreds of partnerships with different health system partners across the country. And I wanted to take a moment to highlight 4 such partners. Ontario Health West. we have launched a groundbreaking project within Ontario Health West that aims to train over 500 learners in LEAP with a keen focus on long-term care and an additional 720 learners in the Canadian Serious Illness Conversations course, concentrating on primary care, all within a span of 6 months. So this is quite remarkable. And what sets this endeavor apart is our dedication to taking on the coordination responsibilities typically managed by our partners. So we're embarking on a journey to oversee a total of 14 LEAP sessions, 60 serious illness conversation course sessions from inception to conclusion. And by taking on this workload on behalf of our partners, we empower our partners to redouble their focus on patient care, all while continuing to provide essential education in critical domains such as palliative care. Saskatchewan Health Authority, again, we've partnered with them to train several hundred healthcare professionals over a 3-year time period. To accomplish this, we're working very closely with them to train their coordinators so that they are self-sufficient and able to run all sessions internally. In addition, we've increased the internal facilitator network by increasing, by training 4 new associate facilitators who will be facilitating their upcoming sessions. And Canuck Place is a new partnership. Again, that it's a group that helped us bring our LEAP pediatric course to Western Canada. They've helped to peer review, finalize the content, share content for the course, and members of their team have become certified LEAP facilitators. And most recently, with the University of New Brunswick, we've partnered with UNB to increase palliative care competencies in the province's long-term care sector. So healthcare professionals working in long-term care homes will have access to one of several courses that have been arranged for this purpose. So that gives you a flavor. On the next slide, at last year's AGM, I shared some news about 4 new partnerships that we entered into aimed at building palliative care capacity on a significant scale. And these partnerships are primarily focused on the spread and scale of LEAP courses, really at unprecedented levels, both for us, but for these organizations as well. And so the past year, to give you an update on these, has really been spent operationalizing these partnerships. So our partners at Alberta Health Services, for example, have trained close to 1,500 healthcare professionals last year, compared to a few hundred in prior years. So we're seeing these partnerships really begin to ramp up. And we've, again, as I mentioned earlier, bolstered our staffing contingent to ensure that we're continuing to provide a strong level of support and service. Next slide, please. Regarding the Palliative Care ECHO project, it's been a very strong year for this project. We officially became an ECHO super hub through the ECHO Institute. And that means that we've joined the ranks of some 32 other ECHO super hubs across the globe, and only the second in Canada. A super hub is an experienced ECHO partner that is authorized to provide training and technical assistance to new hubs and support them as they grow their ECHO programs. We launched a new Palliative Care ECHO project website. If you haven't seen it, I encourage you to visit echopalliative.com. As many of you know, the Palliative Care ECHO project delivers the majority of its content through national, provincial, and even regional communities of practice and educational series. And these bring together healthcare professionals with shared interests to foster continued knowledge exchange and interactive case-based learning. And several new communities of practice have come online this past year. Long-term care quality improvement and severe and persistent mental illness series were launched. And the recordings, by the way, of all Pallium-run communities of practice and series are available for viewing at echopalliative.com if you're interested. And since my report last year, we've also welcomed on a new hub partner, Covenant Health, which is great to see. And in terms of our key performance metrics on the next slide, we continue to see growth in ECHO learner encounters, sessions, recording views. We've reached over 1,600 downloads to the Palliative Care Journal Watch podcast, with listeners tuning in from all over the globe. We've been working on the first ECHO research and evaluation project with the Dr. Joshua Shad Pallium Canada Research Hub. Switching gears a bit on the next slide, I want to give an update on some of our community engagement activities. And one of the projects I really wanted to give a shout out to is the Compassionate Communities Evaluation Guide. So in conjunction with the BC Centre for Palliative Care and Hospice Palliative Care Ontario, we launched this evaluation guide. And the guide really empowers compassionate communities in their efforts or in their endeavor to enhance the quality of experiences associated with serious illness and caregiving and end-of-life care and grief. The guide assists users in assessing individual activities, projects, or programs within their sphere of initiatives. And in particular, it really helps users in the development of their evaluation strategies and data collection, laying out a robust groundwork for the creation of impactful and compassionate initiatives across Canada. The last thing I'll say, and it's not called out on the slide, but with the support of Arbor Memorial, we continue to expand our Care Connections programs into communities across the country. And the program, which provides free practical training and resources for caregivers and communities, was accessed countless times over the year and supported many Canadians on their caregiving journey. Let's go into the next pillar around thought leadership. And, I really want to give a shout out to our scientific advisor, Dr. José Pereira, who you'll be hearing from in just a few moments. He has been the author and co-author on this past year on 2 published papers focused on exploring the experiences of long-term care clinicians with respect to providing palliative care and understanding if learners implement into practice what they've learned in a palliative care course using our commitment to change reflections. I want to say that these papers that are published, in addition to representing a tremendous amount of work, not only validates the impact of our work, but it also contributes to the broader knowledge base. These papers really help to advance the field. They benefit other organizations, researchers, other practitioners who are seeking evidence-based practices. I think it also fosters transparency by showing that we're committed to openly sharing our methodologies, our results, and even potential limitations or challenges faced with our programs. It also supports our advocacy efforts by ensuring that policymakers and funders better understand the significance of our work. So these publications, along with many that have preceded them, really play a crucial role in Pallium's influence and sustainability in pursuing its mission. Next slide, please. Also under the thought leadership pillar is the work that we're doing with the Dr. Joshua Shab Pallium Canada Research Hub in the development of a Canadian Palliative Care Atlas. And of course, we'll be hearing from Dr. Centeno a little bit later on about this. But this atlas is serving to map out existing strengths, areas of excellence, and gaps across regions and provinces with respect to palliative care service availability. So this atlas will showcase a graphical representation on the status of palliative care in Canada and serve to advance really a systems thinking approach to healthcare by identifying several benchmarks of excellence and leadership. So I'm happy to report that the project's initial pilot involving a few regions in Ontario, one of which you see here on this slide, which is formerly referred to as the Central East Lynn. That's going to be wrapping up this year. We're going to be presenting these results at the Canadian Hospice Palliative Care Association conference this fall, along with an event in the fall to share our pilot results with the members of Parliament in Ontario. So we're excited about that. And the lessons learned from these pilots have informed the development of 3 other provincial atlases that are now underway in BC, thanks to funding received from the Sovereign Order of St. John's Knights Hospitaller, in Alberta, thanks to funding received from the Alberta government, and in Ontario, thanks to funding from the PSI Foundation. So this project really is a first of its kind in Canada. No mechanism currently exists to systematically collate this data from an entire sector and make it available in one single repository or access point. I'm very excited about this. Next slide, please. I'm also thrilled to share that Pallium Canada has successfully hosted its inaugural meeting of the Provincial Territorial Advisory Group in Palliative Care, which is a knowledge exchange forum for provinces and territory palliative care leads to meet and share information on matters pertaining to palliative care. And this is a meeting that was held this past May in Vancouver. It brought together representatives and experts from provinces and territories across the country. And this collaborative session was really focused on sharing updates on national initiatives, sharing evidence of program impact, latest research in palliative care and information on important trends impacting the palliative care sector. And a big thank you to all those who took part in this meeting. It's a promising step forward to our shared goal of ensuring that all Canadians have access to early, more effective, more compassionate palliative care. And we have a second meeting coming up this fall in Halifax, and we're looking forward to that. Next slide, please. On the government relations front, we've been quite busy. We've engaged and created a robust government relations strategy to build relations with decision makers in the federal and provincial governments. Our engagement plan primarily is focused on federal, Ontario, and Quebec governments. Government engagement in these three main jurisdictions really has helped to raise Pallium Canada's profile among decision makers. Due to which they recognize the organization as a key player in healthcare and certainly in palliative care. The federal government in particular has acknowledged the benefit and the impact of the investment that they've made in Pallium Canada's LEAP courses and how our organization has been able to successfully expand across the country. One of the key events this past year was the Federal Lobby Day that we held here in Ottawa last February. It was the first really ever reception of its kind on Parliament Hill, and attendees, including members of Parliament, political staffers, representing all three main federal parties, along with senators, who have political sway, as we know, in the upper chamber of Parliament. Over 50 people attended the reception to learn about Pallium's ongoing work. And the reception provided a great opportunity for us to establish cross-party relationships that we know can be leveraged in future advocacy efforts. In Ontario, we continue to be viewed as a trusted partner to the Office of the Minister of Long-Term Care. Former Long-Term Care Minister Paul Calandra had firsthand witnessed the benefits of LEAP courses for healthcare professionals. And the office is holding currently internal discussions to evaluate how it can better support the spread and scale of LEAP courses across the province. We've also began initial government relations efforts in Quebec. The organization first engaged with its health and education partners in the province to evaluate the most effective way to engage the Quebec government. And the stakeholder engagement has also provided Pallium with the opportunity to build support, which can be tapped into for future advocacy efforts. So establishing relationships with the federal governments in this past year in Quebec and Ontario has really helped lay the foundation for successful advocacy in the future. It was an important first step to open up communication streams between our organization and key decision makers. So we look forward to continued efforts on that front. On the next slide, very quickly, we're very proud to be part of a vibrant stakeholder community. Stakeholder collaboration helps us gain fresh perspectives and insights. It enhances our decision making, and it often leads to increased credibility as we endorse and support the others' initiatives, strengthening our collective impact on shared goals and sector challenges. Well, I don't have time to call out each of these important collaborations. I will briefly share that a year ago, this month actually, Pallium wrapped up its first year in a 3-year commitment in the capacity of Secretariat of what was once called the Quality End of Life Care Coalition of Canada, but we've since rebranded as the Palliative Care Coalition of Canada. So we're very proud of these collaborations. Let's move on to our last pillar, which is operational excellence. If we go to the next slide, first off, this year marks the end of our existing 3-year business plan. And over the past year, we began work on our next 3-year planning cycle. We've engaged a consultant who has solicited and consolidated insights and data from many different stakeholders, which has helped provide the board of Pallium and our leadership team with really a solid and shared foundation on which to begin the dialogue about what our future role should be. And where should our focus be in helping to improve palliative care in Canada. So we look forward to sharing this new plan with you next year. As our organization continues to rebound and grow post-pandemic, we need to ensure that we are aligning our organizational structure with our long-term goals and vision. We have been recruiting individuals who possess not only the right skills and expertise, but who also fit within our culture, who can drive innovation and productivity and position us for sustained growth and achievement. These strategic hires will continue, especially as we look to tap into new market potential and service our growing base of clients. So this past year, we've really put a large focus on ensuring that the right people and processes are put in place to support the ongoing growth of both our LEAP and our ECHO sessions, while remaining flexible and focused on partner success. We also undertook a search for 2 new board directors with a background in finance and audit and Quebec stakeholder relations. The results of our recruitment efforts will be announced a little later in the agenda by our chair, so I'll leave that. But enhancing board performance and effectiveness within our organization is essential to ensure strong governance, strong decision-making, and ultimately the achievement of our mission. And to that end, we've launched a board education plan that we've been working steadfastly on over the past year. I want to call out on the next slide work around our IT infrastructure and maintaining and updating the brains of this organization is of paramount importance to Pallium. And it's importance for a number of different reasons, right? We obviously have to safeguard our data through regular updates. Regular backups and disaster recovery plans are crucial components, to ensure business continuity in the face of an unforeseen disruption. Our learners and facilitators, they expect seamless access to course materials and resources. So our infrastructure has to ensure that our platform is responsive, reliable, capable of handling increased traffic, and delivering a positive experience. We have to ensure that we keep our training relevant and effective as we consider opportunities with virtual reality, artificial intelligence, and interactive simulations. And let's face it, when we experience global events like a pandemic, it really underscores the importance of having a reliable IT infrastructure that supports remote learning. So we're leveraging new platforms and technological capabilities, in particular AI, to automate and simplify and streamline work for our account management team, our finance team, and our support desk. We've begun to implement new dashboards for ourselves internally, but also for our clients. RedCap was introduced last year, and that's going to strengthen our data capture and the management and our sharing capabilities, really to support the ongoing evaluation and impact, frankly, of all of our work. And this system's already been used to undertake a 5-year retrospective study on the long-term practice change of LEAP in partnership with the province of Nova Scotia that I'm certain José will talk about a bit later. And we're also undertaking a number of different improvements in user experience on our main website, pallium.ca. So this leads me to the path forward. And on the next slide, as we look ahead to a new fiscal year and the start of our next 3-year planning cycle, it's really important that we take a moment to reflect on a few of the challenges within healthcare that are top of mind for our stakeholders, that are top of mind for our federal and provincial territorial health ministries and senior healthcare leaders. We don't operate in a vacuum. We need to ensure that we understand the environment in which we're working in and position Pallium as a partner and solution provider to help address some of the challenges that you see on the screen here, right? We know in the aftermath of COVID, our healthcare system is facing a big backlog of procedures. The health workforce is experiencing burnout conditions, and that's led to staff shortages and job vacancies among healthcare practitioners. Misdiagnosed due to delayed care are certainly adding additional challenges to the system. Our aging population continues to increase demand for care, given that the highest healthcare costs are incurred in the oldest age cohorts. And when it comes to making better decisions on health policy and spending, we need data and information from our health information systems. And Canada doesn't have a national database for its more than 100 health authorities and regions, to compare human resources and health data. So, and we know that the most substantial portion of provincial territorial budgets is allocated to healthcare expenditure, right? And PTs are grappling with substantial demands for healthcare services, resulting in a growing need for additional federal funding to maintain a sustainable healthcare system, both for the present, but for the future as well. And so these challenges necessitate real solutions and certainly attention. So what does this all mean for Pallium and palliative care? Well, we believe we offer many solutions that can help address several of these challenges. Our work serves to build capacity in healthcare. Our work transforms practice, and it transforms our settings of care, by equipping primary level healthcare professionals with the skills and knowledge to provide earlier, more effective palliative care. And results from a recent study, well, actually, one of the ones I referenced earlier in the presentation, shows that LEAP courses also positively influence the culture of the work setting. In this particular case, it was in palliative care. But to truly realize the full benefits of these evidence-based solutions, we have to take a systems approach. And if we're going to affect system-level change and a culture change, a critical mass of healthcare professionals across the whole healthcare system, as well as the public and health policymakers, need to become acquainted with the palliative care approach and be able to apply it. Right. The example that I always hear José giving is when you have a patient with heart, lung or kidney disease, for example, they won't benefit from early palliative care if his or her specialist has not been oriented to the approach. That patient's family physician or home care nurse is not able to apply the palliative care approach if there exists a discord between what the family physician is saying and what the specialist is advising. So focusing on only one sector or profession or disease group will not lead to the culture change and the system preparedness and the system capacity that we know is so desperately needed. So what I'm sharing obviously isn't a silver bullet, but rather that we have important pieces of the puzzle paid for by Canadian taxpayers that are ready for spread and scale. So on the next slide, in addition to this foundational work to help address some of these challenges, we've also been working on some really interesting projects that demonstrate our ability to deliver value beyond foundational palliative care education. Canadian Serious Illness Conversation course, we were approached by a group of national stakeholders to develop a new standardized national training program for serious illness conversation, building on existing training solutions from across the country while leveraging our instructional design expertise and expanding our network of content developers and palliative care champions. This course allows Pallium to offer a more diverse suite of programs to our LEAP clients, but we also help supercharge an important initiative. We're helping to scale this course and meet broader palliative care learning objectives of our partners, from a light introduction to core foundational skills and deeper dive learning opportunities. Secondly, a course on anti-Black racism in healthcare. So in 2021, we were approached to provide our instructional design and program delivery capabilities and expertise to support the Black Health Education Collaborative in the development of a course on anti-Black racism in healthcare. The Black Health Primer, as it's called, is able to transform health and medical education by combating racism and supporting the inclusion of racially just practices and competencies. So the Black Health Primer is an introductory course on anti-Black racism for all healthcare professionals and students that'll advance scholarship and promote dialogue about the critical issues of anti-Black racism and bias in healthcare professions and in education and practices in Canada. So we're very proud at Pallium to have been given the opportunity to share our expertise to support this important endeavor. And then lastly, just to call out, some of the work that we've recently done this past spring in Portugal. So the reality is that, demand for our training extends beyond Canada's borders. And we worked in partnership with the Palliative Care Association of Portugal to deliver a series of LEAP courses in partnership with local palliative care physicians who provide that important local context. And courses were delivered over 4 days and were very well received by the learners. So this leads me to, on the next slide, our future areas of focus. Give you a sense of what we're thinking about. No surprise, the very first one, continuing to accelerate our national palliative care capacity building efforts. Based on some market study work that we've done, it's evident that there's still a lot of work to be done in this country to build capacity, and we remain passionate and committed to continuing our work to support healthcare professionals throughout their learning journey, from the time they're in school to throughout their professional career. And we're really excited about some of the larger partner engagements that we've secured over the past few years. And we feel that momentum is really starting to build. And we're really going to start to see greater investments in palliative care training and capacity building. And we're ready for that challenge. Secondly, it's interesting. You know, I talked a moment ago about some of the work we've done in Portugal recently. The reality is that we've been working with organizations in different countries as far back as 2008, when our palliative pocketbook was translated into Japanese. And we've delivered courses in the Caribbean and Ireland and most recently Portugal, to name just a few. And demand for our training internationally continues to grow, and we will carefully evaluate each opportunity to ensure that we have the funding, the resources, and the bandwidth to support these opportunities. We're very motivated to extend our value offering outside of Canada, where more primary palliative care capacity is needed, but we need to do so in a way that doesn't take away from our primary focus, which is Canada. And lastly, as I just shared a slide ago, we've been able to leverage our deep subject matter expertise, our learning management system platform, to deliver palliative-centric education outside of the LEAP model. So in addition, we've also been able to leverage our instructional design and program delivery capabilities to develop non-palliative care courses within the healthcare sector. So these experiences have motivated us to explore what potential exists to deliver value in healthcare more broadly. Finally, this leads me to a thank you. And on the next slide, I want to, I really like to describe the work that we do at Pallium as a team sport. All of the groups that you see here on the slide, and it collectively represents hundreds of individuals. They're part of a team at Pallium, right? They're part of Team Pallium. I would like to take a moment to extend my heartfelt gratitude to our dedicated and passionate team of employees whose tireless efforts really form the bedrock of our success. To our esteemed board of directors, thank you for your visionary leadership and unwavering commitment to our mission. Our facilitators and trainers, along with our subject matter experts, you have been instrumental in driving our initiatives forward by sharing your gift of teaching and your invaluable knowledge and expertise. The scientific committee has played a pivotal role in ensuring the quality and accuracy of our programs. And we extend our appreciation to our esteemed ECHO Hub partners and panelists for their collaborative spirit and contributions. And lastly, we express our deep thanks to our invaluable stakeholder partners who have been steadfast allies in our journey to make a meaningful impact. Together, our collective efforts have been instrumental in advancing, palliative care's mission in Canada and transforming lives for the better. On the next slide, I want to take a moment to express our sincere appreciation for all of our corporate partners, our funders, and our supporters for their unwavering support over the past year. Your partnership and financial support have been instrumental in our mission success. Together, we have achieved remarkable milestones and made a tangible impact in the communities that we serve. Your commitment to our cause has not only fueled our efforts, but has also inspired us to aim higher and strive for excellence. As we reflect on this past year's achievement and look ahead to the opportunities and the challenges that lie before us, please know that your support remains pivotal. Your contribution extends beyond financial assistance. You represent a shared commitment for positive change and a brighter future in palliative care for all Canadians. We look forward to our continued collaboration and growth of our partnership, making a lasting impact on the lives we touch. Thank you very much.
Thank you so much, Jeff. Obviously, a very successful and exciting year, and we really appreciate the contributions of everybody inside the organization as well as outside. I'm very happy to go next to our next item from our scientific advisor, Dr. José Pereira. Over to you, José.
Thank you very, very much. And hi, everyone. And I'm coming to you from the Atlantis Global Observatory at the Institute for Culture and Society at the University of Navarra. Great to be with everyone, and thank you for joining us today. So my role today is to give you a bit of a highlight on the work done in the past year. So it's going back to April 2022 until March of this year, around the scientific aspects of the work that we do. And like everyone else, thank you very much to so many people across the whole country that have contributed in one or other way to all this work. And that's from the educators, the content matter experts, the instructional designers, Uh, the data managers, our support in the online with our online learning management system, and the whole Pallium IT team, the researchers really across the country. Thank you so much. And so I'm hoping to give you just a flavor of this. And next, please. So I was hoping to divide this up into basically two parts with a conclusion. The first one is we're going to look at LEAP and ECHO programs, and I'm going to give you some highlights around the curriculum development and research that we've done around that, and then really zoom in a bit more with the research highlights in the second part of the presentation. Next. So on this graph, we see what's happened over the last 4 years. The blue represents the LEAP core courses that were done in the classroom in person. As you can see, prior to the pandemic, 2019, almost all the LEAP core courses that were presented were done in person in classroom across the country. Now, obviously, we do also have some online courses, but not the LEAP courses. Then in 2020, when the pandemic hit, we had to pivot quickly. And I'm very proud of the work that we did, because we literally, within 2 weeks, we were operational and doing LEAP courses online. In 2021, not surprisingly, the majority of the courses now became online. So the LEAP core courses became fully online, with self-learning online and with webinars online. There was some little in-person teaching that occurred in between the waves of the pandemic, and a similar pattern happened in 2022, and we saw the numbers decrease with LEAP core, but the numbers increased with some of the other LEAP presentations. Now, if you look at 2023, there's an interesting phenomenon in that requests for the classroom events or delivery are beginning to increase again, but there remains a strong demand as well for online presentation. So the big question is, do we do online? Do we do classroom? Do we do hybrid? Well, if we go to the next slide. As a result of the pandemic, I think we're extremely well positioned now to be able to deliver most of the courses in different delivery methods. So for LEAP long-term care and LEAP core, for example, we have a classroom version. We have an entirely online version, and that entirely online version is divided up into two parts. As I said, there are about 12, 15 self-learning online modules, and then the learners come together for 4 webinars where they learn together. The different professions come together to learn together, and using largely cases. So we apply what was learned in the self-learning modules into these cases in the webinars. But we also now have a hybrid delivery approach. And so people can do some self-learning and then come together in a classroom to do the very same cases and case discussions. And that socializing, that's so important. If we look at our ECHO program, we've been using largely webinars, but then also, so these webinars have been used both for the standalone series that we've developed, and I'll come back to that, as well as the communities of practices that we're developing across the country. Next. So some of the curriculum development highlights over this past year, we've updated our specialty programs, we call them. So these are the LEAP versions that target colleagues working in areas such as respirology, in cardiology, nephrology. So these are the people that are looking after patients with advanced kidney diseases. Our oncology program was updated the year before that. And now we've got an online and hybrid version for these courses. As we heard earlier from Jeff, we've also developed the LEAP PSW, and there's been a significant uptake in that. That's entirely online through self-learning. That one does not have the classroom, but what we really encourage our PSWs to join the other courses that are happening with the other colleagues in the classroom. For example, in long-term care, the LEAP long-term care when that's happening, or LEAP core or LEAP home care. In the past, through research and evaluation, we found that the PSWs found themselves feeling a little bit out of the league, or rather out of the scopes that were being covered in the LEAP courses. But as soon as you've given them a basic understanding, some core understanding of what it's all about, they feel a lot more comfortable now joining their colleagues from the different professions. So we hope in the future we'll see them joining more and more the teams, because they are key members of the teams. We've seen the launch of Leap Carers. And then we heard earlier on about the courses that we did in Portugal. There was something interesting about that. And I often say that if we collaborate internationally, it comes back to help us and build up what we're doing. The request we received was, please help us, palliative care specialists in Portugal, to learn more about uh, the palliative care approach, or doing palliative care for patients with lung diseases, heart diseases, kidney diseases, liver diseases. So we modified our Leap Lung, Leap Heart, Leap Renal courses, which target the nephrologist, cardiologist with those core competencies that we call the palliative care approach. But in this one now, we target the palliative care specialists. So there's some differences between those two courses. But now we have these specialty courses that can be delivered in Canada as well for palliative care teams who wish to update their skills in the specialty areas. Next. I'm very proud of our Leap Leaders program. So a few years ago, we were approached by the Canadian College of Healthcare Leaders and asked if we could develop a specialty course as part of their big certification program for Canadian healthcare leaders, and specifically something around palliative care. And the mandate was, these are leaders, so nurture in them leadership, but also give them the tools and the understanding of how one develops what palliative care is, how one develops it, the different models, the pros and cons of different models of integrating it in hospitals, in long-term care, in the community. Staffing, how do we go about organizing the staffing and the referral approaches, for example? And importantly, what's the impact of that to patients as well as the finances, the economy of the healthcare system? So that's all built into that course. And as of actually the middle of this year, we've trained now 300 healthcare leaders with that course. It's an intense course. It goes across several months, and I'm hoping that in the future there'll be a more mini boot camp type of course where we can bring a lot more people to orientate them to the palliative care approach. As part of that leadership building, the Ontario Palliative Care Network recommended that its new leadership structure, these are the leaders, palliative care leaders across the province, participate in our Leap Leaders. And so they've been doing that, and we've made some modifications to allow them to do that and be a bit more specific to the province of Ontario. But obviously that opens up lots of doors for other provinces. And we're also about to launch a standalone online series on psychosocial care, and you'll see shortly why. Next, please. We heard from Jeff about the ECHO program. So just to remind people again, the ECHO program, there are two big streams. The one stream is that's developed, deployed, managed by Pallium Canada, and that includes some communities of practice. And within that portfolio, the communities of practice, we're trying to nurture communities of practice in primary care, how to develop palliative care in primary care settings. In long-term care, there's another one for mental illness, as Jeff mentioned, and then also for heart disease. So just give you a bit of flavor that in the heart disease community of practice, we've got colleagues coming in from across the country, joining in discussions with a panel of experts who've already integrated very effectively palliative care within cardiology programs and clinics, and learning from each other on how to do that and spread that know-how across the country. The Palliative Care Journal Watch is very active. We've got a quality improvement program, and then there are a lot of standalone sessions. So that's the Pallium stream. Then there's also a very big and important stream, and that is the one of the webinars and communities of practice that are organized by our hub partners. And you saw some of those hub partners in a previous slide by Jeff. Next, please. And I'm showing this because we'll come back to some of the research highlights around that. Next. So in terms of the research, let's take a deeper dive into this question about online versus classroom. We've published work on the LEAP core classroom, so on the right-hand side with the orange letters. We did work looking at LEAP learners from April 2015 to March 2017. So during that period, during those 2 years, there were 244 courses across Canada and 4,636 learners from across Canada. At the end of every course, we asked people to please evaluate it. What was the learning experience? Was it relevant to their practices and hence their profession? And would they recommend the courses to someone else, to a colleague? And the response rate there was 65, just under 66%. From April 2022 to March 2023, we delivered 458 LEAP Core online courses with over 7,400 learners from different professions, as you can see on the table, and from across the country. So we've got a fantastic opportunity to compare these two delivery methods. And so I want to give you a bit of a flavor of what we're finding. So this is ongoing work at the moment. But if we look at the learner experience, next please. So we ask all the learners, all the different professions, does a course meet your learning needs? And in the blue is the LEAP Core Online, and in the orange is a LEAP Core Classroom. And across the professions, perhaps with the exception of social workers, the experience or the evaluation is, yes, this course meets my learning needs. With social workers, it falls a little bit short. And when we explored that further through research, we discovered that there are a lot of aspects of the course that social workers feel that they don't need to learn about. So medications and diagnoses of different complications. Hence, the importance of that those freestanding modules for social workers. So we're hoping that those freestanding modules that are about to be launched will fill that gap and allow for social workers a deeper learning experience, and for all the other professions who want deeper dives into the psychosocial aspects can do that. But by and large, you can see not big differences between in terms of this domain of the learning experience. Those little stars you see are statistically significant differences, but I would argue that they're not necessarily clinically significant. In other words, they're not really that significantly different in terms of a practical impact of it. Next, please. Another domain we looked at was the course overall a good learning experience? And again, very similar between the two delivery methods. Not surprisingly, social workers found, again, it less of a good learning experience, still not bad, 75% for the classroom, but down to about 65% with the online. So we're looking at that to see how can we fill that gap, but we're really pleased to see fantastic evaluations across the other disciplines or professions. Next, please. And then when we ask them, would they recommend the course to colleagues, which is actually a very important industry marker, indicator of acceptance of the course, pretty good. Next, please. We looked in more in depth into the strengths and the limitations of the course, the online one. And interestingly, a lot of people said this was very helpful to overcome the restrictions placed upon us by the pandemic and also geographic challenges. I'm up in the north. I'm in a very rural region. I can't break away from my work. Very positive learning experiences across a number of areas that I won't go into in depth. In terms of the limitations, there are some learners that clearly say, I much prefer the in-person learning. And I really get a lot out of that socializing aspect of it, getting together, learning together. So I think the message here is for both of the classroom, online, hybrid, there are enormous strengths, areas for improvement, but it's great to have the options available, the different options of delivery available. Next, please. We've also looked at the impact of knowledge and comfort and attitudes related to palliative care with these courses. And this slide, I just want to show the slide to show that there is significant gains pre versus post course with knowledge across the different disciplines. This is the LEAP Core online results very significant differences pre versus post. And if I were to show you the slide of LeapCore Classroom, it's almost identical to this. So the differences between the two, we don't see a big difference in terms of impact. So we don't see less of an impact with the online. Next, please. When we looked at commitment to change in the classroom one, we've published that, and Jeff highlighted one of those papers. When we looked at the online, we saw very similar results. 4 months after completing the courses, immediately after every course, we ask learners to commit to identify 3 to 4 things that they would be doing differently in their practices as a result of participating in the program. 4 months later, we asked them, did you implement what you said you were going to? And the learners self-rated that they had implemented about 75% of their commitments, almost identical number to the classroom, and similar themes from pain management to advanced care planning, grief and bereavement support, better use of medications, and importantly, early initiation of palliative care. Next, so not many big differences between the LeapCore Online and the LeapCore Classroom. Next, please. Jeff mentioned about the Nova Scotia study. We've been asking ourselves, what's the long-term impact? Do people go to a course? We hear that at least 4 months, they're implementing a lot of what they learned, but what happens after that? So this is very preliminary data that we're getting out of a survey we did across the country, across Nova Scotia. The response rate was not optimal. It was 12%, but there are 149 people that did respond out of the 1,200 who completed the courses. And from that, we get some really interesting insights. When we asked them if they were still applying in practice what they'd learned, 86% of the learners said, I'm still applying it. And then this one is extremely important, particularly at a time when the healthcare workforce is exhausted. We asked the question, has the course increased your job satisfaction caring for persons with serious illness? And on a scale of 1, where 1 is strongly disagree and 7 is strongly agree, the average was about 6.6. So very highly scored that the course is giving them job satisfaction, a very important impact of the course. And 75% of the respondents have said that the course has improved the care they provide, and 22% said it maybe I didn't learn more, but it confirmed what I was doing, and that was good. Next. I'm not going to go into much detail about this, and this is a study that we did at the Joshua Shad Research Hub at McMaster University, and the question was posed to healthcare professionals working in long-term care. What was the impact of the COVID pandemic? What was your experience like caring for patients in long-term care? And several of the participants identified specifically prior training that they had received, and some of them highlighted the LEAP training that they'd had as almost a preventative thing. It helped them prepare for the pandemic. It helped them weather the storm of the pandemic. It helped them provide much better care during the pandemic. Next. We've just finished another paper that we've submitted recently, and we're waiting to hear what the reviewers are going to say. A qualitative study with 10 long-term care staff who had completed a LEAP long-term care. So there are 4 practical nurses, 3 nurses, 1 nurse practitioner, and 2 physicians. And after 10, we reach what we call scientifically saturation. In other words, we weren't hearing more new things after those 10. And they reported positive impact for them on themselves, their ability to care for residents, on their ability to better manage their residents. They, again, as in the study, increased work fulfillment as a result of getting the training. There were ripple effects. What they learned, they were sharing with their colleagues throughout their facility, their services in the facility. And interestingly, there were ripple effects beyond their facility where they were connecting with other home cares facilities, long-term care facilities, to improve palliative care. Next. You've heard about the Atlas. I'm not going to go to it in detail, except to say, as we've been doing the Atlas, we've started realizing that sometimes you need to pull out a microscope and go in a little bit deeper, get a bit more granularity. So in this region, for example, on the right-hand side is a map of a region with its sub-regions. We've discovered significant variations between these sub-regions. So if you simply look at a big region and you say, yep, there's palliative care available, you might miss some of the details where there's some areas that have got no palliative care, um, which is indicated here in red. If you look at the green aspects, it looks like there's palliative care, and there are palliative care teams, but there's a deeper question around this, and that is, how are they working with or engaging primary care folks around their region? Because maybe they're having to do all the palliative care and primary care is not actually involved. Next. So it's giving us some really interesting insights on this Atlas work. We've heard the results of the echo, so I won't go into that. We can jump this, but fantastic growth in it. We're particularly excited about the views of the recordings afterwards. It's now reached 12,000. So although there are on average about 30 to 60 participants in each of those webinars, either done by Pallium itself or by the hubs, there are thousands of people viewing them and reviewing them afterwards. And the learner experience, as shown on this with our research, is very, very good, very high. So this is the percentage of people who have agreed or strongly agreed with statements such as the session was relevant to my practice, I had opportunities for discussion, etc. Next. So just giving you a flavor of these different findings. We also asked the question, how has the ECHO project helped people, hubs implement their own particular ECHO program? And so this is a study that's just being finished. We're busy writing it up. Some of the partners came back and said, you know what, before this, we didn't have capacity to do the education. The ECHO program has given us the capacity. What's been wonderful is that the ECHO program has connected us with other networks, with other people, which is one of the goals of these communities of practice. We also identified areas for improvement, and one of those areas we're already addressing. In those early months, people felt that they were having to learn on the fly. Well, we're all having to learn on the fly because this was somewhat of a new approach to supporting continuing learning. We've learned a lot, and from that, we've already made modifications, and we're already hearing back how those are helping. Next, please. So in conclusion, there's ongoing evidence of spread of the LEAP and the ECHO program. It's making an impact. It's making a difference. We keep doing the research to find this, the evidence, and looking for evidence to inform the next generation, of course, is the next generation of deployment, and our next approach is to get to the healthcare professionals. Thanks very much. Thank you.
Thank you very much, José. Very thorough report, and really appreciate it. Next on our agenda is a financial report from the chair of our Audit and Finance Committee, Jeffery Morton. Jeffery.
Great. Thanks, Louise. Good morning, everyone. It's my honor to present the financial report. As time is not our friend, it'll be tight and concise. 2023 was a very successful year for Pallium, wherein they exceeded their revenue targets, generating year-end bottom line results significantly better than the budget. The 2023 budget was built on the understanding that it would draw down on its reserves to fund exploring new initiatives that would benefit Pallium in the long view, not just the current fiscal year. The audited financial statements reflect a loss of $111,000, well below the $292,000 board-approved budget deficit. Pallium continues to enjoy a strong financial position with net assets of almost $1.9 million and cash and short-term investments of over $2.3 million. I can report the audited statement include an unqualified opinion, and I can also report that it was a smooth and efficient audit process that was completed by the auditors in concert with management. That concludes my financial report.
Thank you very much for that very succinct report.
We do have the matter of approval of the matter of the appointment of the auditors for the coming fiscal year.
Okay.
So the motion would be that the firm of Kelly Hubers McNeely be appointed as auditors of Pallium Foundation of Canada for the fiscal year end March 31st, 2024.
I think I can second that motion if you're making it, Jeffery.
Yeah. Yes.
Okay. Thank you very much. Anything else from you?
No.
Okay. Thank you very much. And I have the next two items. Donna was unable to join us today as the chair of our governance committee, so I will step in for her. And so we have this morning presented to our board of directors were two new people, Yves Lorange and Bernard Lepoint. And Yves comes to us with a very strong financial background and a CPA. And Bernard, which many of you on this call, on this webinar, are quite familiar with, having an extensive background in palliative care and very well known for his expertise in the area. Both of these members are from Quebec, so we're delighted to have a strong representation of Quebec on our board. And this was put to our board this morning and was passed unanimously. So we're delighted to welcome both of them to the board of directors of Pallium Canada, and it will serve us well, taking us into the new year. The next item is while we welcome some new board members, we have to bid farewell to a couple of others. And you'll see the pictures on your screen, which is Gerald Savoie and Beverly Lepine. And so while we're sad to see them go, we are very grateful for the contributions that they have made to Pallium Canada. Jerry has been the chair up until about a year ago when he became past chair, and there's a position for past chair on our board for a year. And I personally want to thank Jerry for his help and his mentoring in bringing me on board as the new chair. And Beverly for her all of the time and unwavering dedication. Both have played a pivotal role in guiding Pallium Canada during a critical juncture in our organization's journey. And I can assure you we would not be where we are today if it weren't for their contributions. So we want to wish a heartfelt thank to both Gerald and Beverly. And we know that you will be part of us watching our progress and so forth as we move along. And I'm sure it won't be the last that you will be hearing from us, because we'll be calling on you both from time to time for your wisdom and your expertise. So our sincere thanks to both of you. So with that, it brings us to a very special part of our meeting today. And Dr. Centeno is, as we mentioned, Director of Palliative Medicine at the University of Nevada. And I have heard a great deal about you, Dr. Centeno, from a couple of people, and I'm very, very much looking forward to hearing from you. So thank you very much for joining us today, and I'm happy to pass our virtual podium over to you.
Thank you very much. Can you hear me?
Yes, we can.
Can you hear me well? Okay, thank you. So first of all, thank you for the invitation. Thank you for giving me the opportunity to follow this very interesting meeting. I am out of my country, but very impressed to see the development of Pallium in the last year. So you are doing outstanding work in the field of palliative care. I feel, I don't know how to say, I feel very impressed for the work that you are doing in a country that I love very much. So the invitation that you did, it was to share some of my experience that have accumulated in the last year with the Atlas of Palliative Care in several regions of the world, because you are now working in the Atlas of Palliative Care in Canada. Probably because that reason, Jeff and José invite me to share some of the big thoughts, because I will be brief, giving only a few thoughts about that. Thank you for this slide. So you can see here that our journey presenting Atlas of Palliative Care around the globe starts before 2013. So at least are 10 years, are more really, 10 years building high quality Atlas of Palliative Care. We start addressing the situation in Spain, and we move quickly about to evaluate regions of the world. I will explain later. Probably previous to my presentation, I have to say something about my home, my institution. My institution is a research one. It's an institute for humanities and social science research, the Institute for Culture and Society, that is located in the University of Navarra, Spain, where I am professor of palliative medicine. We try to do research to understand humanity and to respond to the society's global challenge. One of the challenges is the care at the end of life, and this is because ethics, the Atlantis Research Group, from 10 years today, until today. What is the Atlantis Research Group? It's a group of researchers from several disciplines that try to promote the positive values of the professional caring for those with serious illness. This group of researchers have several branches, several focus, 3 focus, in fact. No, the previous one, please. Thank you. We have several focus, but one of the focus is to evaluate the situation of palliative care globally. And we are doing that with the Palliative Care Atlas. What is a Palliative Care Atlas? It's a graphic representation of very deep research, very broad research, trying to capture the evolution of palliative care in a region or one area, geographic region or geographical area in the world. And it is designed to do an impact that has to be visual impact. The people has to get immediately the evolution through the figures, through the map, through the graphic. And at the same time, has to be able to compare the situation of their own region with the neighbor regions too. Next slide, please. So these are the Palliative Care Atlas. How we present the information? Very visual information with infographics, with map, with numbers, with different figures, easy to understand, not only for professionals, but even for politicians, so, and the general public too. Next slide, please. Why the atlases are so important in the medical and in the educational context? Because they are very powerful advocacy tool. The atlases promote palliative care, are motor or palliative care, connecting professionals with the experts and politicians and the media. Advocacy tool. Number two, because it's a kind of nice introduction card. It's a kind of card credential for presentation. This is palliative care. Palliative care is not only the service, but also the education and also the policies for at the end of life, and are also the society that wants to care. So this is palliative care. So an atlas is showing this credential of palliative care to the general public and to the professional in other fields. And number three, our atlas are powerful because they have a positive, very modern design. In the palliative care atlas that we are producing in the University of Navarra, we try to show with the drawings, with the colors, that palliative care is life. The palliative care is alive. That palliative care has color. Palliative care is not black. Palliative care is not, no, palliative care has values inside. With these designs, we want to communicate this energy, this power, this joy of palliative care to the general public. Next one, please. So our journey starts 20 years ago, probably, in Spain, when the people with the Spanish society asked to us to do the list of palliative care services. So we produced the Spanish Directory of Service several times, several years. And at the same time that we produced the list of the services, we also produced the map of palliative care in the country. And that was the starting point. And this captured the attention of the European Society of Palliative Care. In a meeting in Spain, the board of directors of the European Society understand that this way to present the reality of palliative care could be powerful to promote palliative care globally, more globally in the region. So they asked us to produce that they call at the beginning the Palliative Care European Directory. So at that moment, we changed our main is to try to evaluate the number of services in every country is the wrong way. We have to evaluate palliative care globally to other level, to the macro level. Not only the number of services, but more things, the policies, the education, the use of medicine. So we start to create the European Atlas of Palliative Care in Europe. After that, other regional associations, as the Latin American Association, call our attention and ask to us to produce same visual credential card for their region. So then we produce the Latin American Atlas of Palliative Care. And when we present that in the conference, in international conference, people from other regions of the world came to us asking, please, we can support that development too in our region. And then we did the evaluation of the Arabian countries and also the Africa Palliative Care Atlas. But the things didn't stop at this point because then the societies asked for an update of the situation, the European society called for a new edition of the Atlas of Palliative Care twice. And this is one indication of the power of the Atlas. When the society, the professional society is asking again the evaluation, means that is a powerful tool for advocacy. So, as an anecdotic issue, one day when I was in a Latin American conference, I meet the person that is in the photography, and that person, when present her poster, give me a very good explanation about the situation of palliative care in one country of Central America. But it was in English. And I asked to her, but what you are doing in Central America, promoting palliative care? He explained to me that one day, the Atlas of Palliative Care of Latin America came to her, and he opened the Atlas and he saw that in this region, nothing was done in some non-students of medicine spend the summer in Central America promoting palliative care. Next, please. We have also challenge in our journey, and we try to overcome that challenge. One challenge is the temptation, every time the temptation to change the level of analysis. The level of analysis means that you are addressing the situation of a country or a big region, but you have to stay in that level. You cannot go from the macro level, that is the level of the structure, the level of the policies, to less level, that is the meso level, that is the level of the services, the level of the communities, the level of the organization. You cannot address in detail in two different countries this meso level. So this is a challenge to keep the indicators always in this level that is very approachable and very feasible, and no deeper level that is the responsibility for the own organization or the own countries, but not for the technical office addressing the situation. One challenge. The other challenge is over the years, we are using less and less indicators, but better and better indicators. So in this case, the evaluation of palliative care that you have to use is good indicators. What is a good indicator? One indicator that indicates that estimates well the dimension that you are addressing. For instance, if with one or two indicators we address the situation of the education of palliative care in Canada, I don't need to use 10 indicators addressing not only if the university are teaching palliative care, but many other details. So less indicators with better quality, with previous consensus of the experts that are relevant and feasible for estimation of palliative care development is other challenge that we overcome with this philosophy. And always, when you are doing evaluation, the risk is to have bias. The bias here is that when you are using professional has the temptation of to overestimate or to decrease the level of estimation. Sometimes it's because they want to show that the country has more, another time is the understanding that showing less, you can promote more. So you have to overcome this difficulty, and we do that with triangulation of sources. We use several sources, and we do peer review of the information later on. Next, please. The previous one. So, very important issue is to understand a palliative care evaluation in an atlas exercise, mapping exercise as an approach. And you have to be humble because you are not the main, you are the evaluator only. You are the technical office, and the main is the organization that is promoting the evaluation or promoting the atlas. That could be the national authority or the regional authority, or could be an umbrella organization that could be professional or official. But in that way, to evaluate a region, you have to find partners because many people want the same that you want. People that is aiming the same that you are aiming can have place in the scientific board of the atlas exercise. So the regional office, or when we pan evaluation, or other global institution, when you are doing evaluation of big regions in the world, it's potential partners of this exercise. And any other body that wants to promote palliative care has place in the scientific board of that exercise. Next, please. In this way, for instance, when we evaluate Africa, we produce not the University of Navarra Atlas of Africa, is the African Association for Palliative Care Atlas of Palliative Care in Africa. And we are the technical office in the University of Navarra. In that atlas, other organizations were involved. What organization? The International Association for Hospice and Palliative Care, that is an association that is promoting palliative care, especially in those countries that are with low income, is the case of Africa. And the Global Palliative Care Organization, that is WHO HPCA, was also a partner in this Atlas of Palliative Care. And also the International Association for Palliative Care for Children participate in this program. And you can see at the bottom these very small points, because in that exercise we have more than 100 key persons giving the information as the source of information of the Atlas of Africa. Next, please. So, to have the global idea of the importance of the Atlas in the last 10 years, we produced almost 50 articles in scientific journals. We produced 13 monographies, 13 books with the evaluation of the countries or with the methods that we are using. And we participate usually in national or international conference, presenting methods and presenting preliminary results. And you can follow through Google Scholar, for instance, the impact of these atlases of palliative care. Every atlas is achieving more than almost 100 hits in the citations in the Google Scholar database. So with all these atlas, very recently, called to our door, asking to participate with them in the monitoring of palliative care globally. Now, the University of Navarra is a collaborative center for the global monitoring of palliative care development. And the first step of this collaborative center, it was to refine the methods. And now we have new methods, that is the refining of the methods of the last 10 years to evaluate the development of palliative care in the countries. Through this All Atlas, we increase the awareness of palliative care worldwide. And we raise the awareness in the public domains, but also call the attention to the policymakers and the reporters that are interested in the explanation of the development of palliative care in the country. Several countries use the information to create new laws or new policies of palliative care. Through the Atlas, we are collaborating in promote palliative care around the globe. Next, please. And in this journey, we meet Pallium Canada. So, and Pallium Canada, through José Pereira, Professor Pereira, firstly, understand that an atlas could be a way to follow in the track of Pallium. What is the track of Pallium? Pallium is trying to promote palliative care education in Canada. And they understand this idea that the Atlas of palliative care can promote also palliative care in a region. So with this idea of advocacy tool, we join effort giving scientific advice. Our role in the Atlas of Palliative Care is give us our knowledge, our expertise to the Pallium team that is the main player in this exercise. So we are giving some methods, we are giving some advice about the indicators that they have to use, and also we are trying to facilitate the way to present the information very visually in the Atlas of Palliative Care in Canada. So, and next, please, and probably the future, you will see the future of this Atlas exercise together, because now is thinking the best way the data are dynamic, with interactive dashboard, trying to promote the user experience. So we are putting all the information that we have in dashboard, in computer, freely accessible to all, that can customize in some way the information that they want to have. Finally, next one, please. Finally, I want to say that this is a very flourishing collaboration between Pallium Canada and ICS Atlantis. Atlantis was an expert in Atlas evaluation, and now we are doing, and we are participating in some way in the evaluation of the situation in Canada. And Pallium Canada was of palliative care education, basic education, and now is promoting in several other ways palliative care in Canada. For instance, as we saw this afternoon, through eco palliative care courses, through serious illness conversation courses, through compassion communities, and in this diversification is using also the expertise of the University of Navarra to build an atlas of palliative care. So in this journey we meet better each other. And now we have thoughts. We are starting to think into collaborate in a new initiative. This initiative could be to facilitate the start of palliative care, the starting moment of Pallium in Iberia. Iberia, as you know, is Spain plus Portugal. So we want to facilitate this starting point of Pallium in this other new region in the world, because it's a win-win situation. Pallium can promote basic palliative care in our region, in our country, in Spain, and also in our dear neighbor country, that is Portugal. So beyond the project, this is not only a collaboration. This is a partnership, a real partnership for a common cause. Thank you. Thank you very much for your attention.
Jeff.
Sure. Dr. Centeno, it's Carlos, lovely to see you again. Thank you so much for your time and for what I think is a very interesting and inspiring presentation about the art of the possible in terms of, what these atlases serve to do, and the work that we're doing together. And I couldn't agree more, is a fantastic partnership. I'm also very much inspired by the fact that the work that you do at ICS as a WHO collaborating center is incredibly impressive, and that's no small feat. So congratulations to you and your team. We are delighted to be learning from your work and working with you to develop our country's first palliative care atlas. We couldn't be more excited, and more to come. So thank you again for your time that you spent with us today. It's been very, very informative.
Thank you to you, Jeff.
Thank you to you.
And thank you so much, Dr. Centeno. That was a wonderful overview, and I learned a great deal. So looking forward to working with you. And now we have a very special hello and recognition from a couple of people. I'll pass it over to you, Jeff, to show and to share with us.
Indeed. So I'm going to, we'll start by having the Premier of Ontario, Doug Ford, say a very brief message. So Sarah, let's play that clip. And we can't hear it, Sarah.
Hi, everyone. Welcome to this year's Pallium Canada's annual general meeting. This is an opportunity for healthcare professionals, organizations, community leaders, and partners to come together and discuss and explore the issues and opportunities in palliative care in Canada. I want to thank you for all that you do on delivering compassionate care to patients and their families. Your dedication and skills are just absolutely amazing and essential to our healthcare system and our communities. You're all true champions. Wishing you all the very best and a great meeting.
Thank you, Premier Ford, for those kind words. And I'm just going to briefly read a message from the Minister of Health in Ontario, Sylvia Jones, who says on behalf of the Premier and the entire Ontario government, they want to thank us for our network of partners and our network of partners for all the work that we do to improve quality and accessibility in palliative care. I know that Minister Jones wanted to be part of this meeting to share a few of her sentiments, but as you can see here, she says, by supporting research, education, and integrated care delivery, Pallium is building more palliative care capacity in Ontario and across the country. We appreciate all that you do to support compassionate, high-quality care for patients, families, and loved ones during what is a very difficult time. As part of our government's plan to ensure Ontarians can connect to the care they need close to home and at every stage of life. They are investing over $147 million over the next 3 years to expand palliative care services across the province and improve support for residential hospices across the province as well. And through ongoing collaborations and partnerships across the health sector, including in palliative end-of-life care, our government is working with organizations like Pallium to connect more people with the comfortable and dignified care that they need and deserve. Thanks again to Pallium Canada for your significant contributions to our healthcare system and supporting patient-centered care. So thank you, Minister Jones, for that message, and Premier Ford for your video. And I'll pass the mic back to our chair, Louise.
Yep. Thank you, Jeff. And yes, indeed, thank you for those kind messages. Again, thanks goes out to all of you who have contributed to making this a successful year yet again, and looking forward to the upcoming 12 months and seeing a similar, if not even better, result next year because of all the contributions of everybody. Thank you for your time today, and all the best.